Welcome, everyone. We are calling this workshop to order. Today we'll be discussing a Min Choices overview as part of the Health and Wellness Service Team Committee of the Whole meeting. This presentation is about how home and community-based services, also known as waiver services, work from a holistic perspective. And talking about the strategic partnerships that have been implemented across the Health and Wellness Service Team that bridge the Social Services Department and Financial Assistance Department, as well as Health and Wellness Administration. So there'll be an overview of sort of the programs, requirements, and operations and changes that have been made, as well as opportunities and challenges. And then there'll be a discussion on how to leverage the existing resources, technologies, and service team model to address those emerging needs. So for the first half of the presentation, we will let the team kind of walk through the programmatic pieces and lay out their vision. And then there'll be opportunities for questions. And then in the second half of the presentation will be more discussion style within the slides. With that, I'll turn it over to Kathy Hedin, our Deputy County Manager on the Health and Wellness Service Team, to introduce the staff.
Thank you, and good afternoon, Chair Fretham and Commissioners, and Happy New Year, everyone. What better way to start the year than to begin with a comprehensive team look at Min Choices, which is a waivered program that takes many departments, as Chair Fretham said, agencies and people to ensure our residents have the services and resources they need to thrive in community. Today is an informational workshop, and if some of you may recall, 5 years ago, this topic was brought before you or the board, some of you. There are many differences between then and now. I think one big one is the collaborative approach to the way that we're looking at this. Today will be a reminder of what the program is, but it will also be a look into the collaboration and partnerships it takes to accomplish this work. A more collaborative approach will continue to enhance the future of this work and these services. As was described, the only way that Min Choices program can work successfully is when social services, financial assistance, our health and wellness admin division, as well as our IS department, as well as the Department of Human Services, the state MINIT or their Department of IS, as well as community organizations and our residents work effectively together. That's a lot of people and groups to bring together to make this successful. We've got a large team on today, and so I won't introduce everyone right now, but each person that presents will introduce themselves and their team that they brought with today. The team will highlight current challenges, especially with the increased demand for waivers as we work through this pandemic. Our public health colleagues would remind us that people are living longer with more disabilities, unfortunately, and many chronic in nature, others due to significant life events. We'll also provide you with what is working now, as well as opportunities for change. And we'll talk about how our work to modernize our human services infrastructure and technology plays a key role in how successful we are in ensuring our residents have what they need as quickly as they need it. So I want to thank the team today and the leadership for the prep that took to come to you early in this year. And I'll turn it over to one of our newest leaders on the team, but certainly not new to the Ramsey County team, Division Director Maria Saravia.
Thank you, Deputy County Manager Hedin. Thank you, Madam Chair Fretham and the board. I also see important leaders from across the county. Thank you for your time for coming today. Also, County Manager O'Connor. As you may presume, based on the intro, we're going to delve into a lot of complicated things. We're going to try to be nuanced and yet balanced in explaining some of the things that we'll present here today. And so my apologies. I believe we're sharing the slides at this time. Is that correct? Okay. Perhaps we can share the slides. And you know, here we are in terms of the title. Again, as Deputy County Manager Hedin has stated, this is a joint effort, and we are working in partnership across the Health and Wellness Service Team. If we go to the next slide, you'll see a overview of our agenda. And this is also some of the agenda items that we've talked about. But if we go to the next slide, it's really the purpose slide. And that's where I'd like to take time again to thank you for your time. And as Deputy County Manager has stated, I'm before you in a different role, but a familiar role in terms of being more steeped in health and human services and connecting to folks who are residents who are seeking human services. And so some of the folks I brought with me today, I'd like to also introduce, and they'll help jump us off. But from the Social Services Department, I serve as the Division Director for Aging and Disability Services and Min Choices. And for the past several months and over a year, we've been working with, very talented staff to get us through the pandemic. And that includes a Michelle Cush, who's a public health nurse who's been serving in a work out of class as a human services manager for over a year. And then we also have with us today Nasro Mohammed, who also joins us, and she's a Min Choices supervisor, and she is a licensed social worker. And together, each of them have over 8 years of experience in home and community-based services. Michelle and Nasro are subject matter experts. And so we're trying to balance the vision, the history, as well as some of the nuance, because it's our understanding that if we know the business, we can tweak it and do better and get to better outcomes, which is, I think, the aim that we have across the service team. So we will, in some regards, delve into a little bit of the historical context of our programming and service delivery, as well as cite some authorities to better understand how sometimes those authorities are competing against each other in terms of when it comes to operations and day-to-day work. Along with us, as Deputy County Manager mentioned, we have financial assistance services with us. We'll be hearing from leaders in that space in just a moment. And then we also are presenting with the Health and Wellness Administration. And again, we aim to illuminate the challenges and the opportunities of how Ramsey County can work with families, with elders, children, and adults who have disabilities, many of which are our own families in some regard. And so, as Kathy stated, this was presented previously in 2017, and we're excited to share some of our evolutions and also be really authentic and forthcoming about opportunities for improvement. And one of the things I would be remiss if I didn't share, and hopefully that will be joined, but we've been really strategic about connecting with our Citizens Advisory Council as well, and working with members of the community who not only experience our systems, and have loved ones or children who are kind of receive services, but then also have a role and have been appointed by the board to help us, advise us, and help us co-create solutions and work together in partnership. And so that community partnership and co-governance aim to provide effective service delivery is something that we call in to center to be very focused and intentional about. And we may have an opportunity to have a CAC member chime in towards the end of this conversation and as we enter into the discussion period. So with that, I'm going to pass it over to our partner in the Financial Assistance Services Department. And I believe Bridget is on the line with us and may have a few words.
Good afternoon.
Oh, there you go.
Good afternoon, everyone. I'm Bridget Bloomer. I'm from the Financial Assistance Services Department. I would like to thank everyone for allowing me to come and share this information with you, Madam Chair, County Commissioners, and County Manager O'Connor. I would also like to acknowledge the leadership of Deputy County Manager Kathy Hedin, as well as my Department Director Tina Curry and the Social Services Director Ann Berry. Following what Maria was saying, we are connected to the Social Services Department to complete this work. Our efforts touch on organizational culture shifts, efforts to support our workforce who serve our residents, building strong partnerships, leveraging community partners while being resident-driven with a systems design and a human-centered service delivery. All of this to address programmatic challenges in a changing economy amidst a pandemic, and as well as we embark on a systems modernization. Next slide, please.
Thank you, Bridget. So as you can see here on this slide, there are several waivered services available to our residents. MinChoices assesses for all of these programs, in addition to non-waivered programs such as personal care assistance, consumer support grant, Moving Home Minnesota, relocation services, essential community supports for our over 65 population, Rule 185, intellectual developmental disability or related conditions case management, and semi-independent living services. Waivered services are an alternative to institutionalization. They help a person live as independently as possible in the community setting and promote optimal health, independence, and community integration. This assists with our focus towards the Olmstead Plan, making sure that residents with disabilities receive services in the most integrated setting appropriate to their needs. Historically, assessments for each program were completed by different teams of staff. So for example, public health nurses would perform PCA assessments for residents. A social worker in one area would perform the assessment for a CADI waiver, and a different social worker would perform a different assessment for the DD waiver, and so on. Upon implementation of MinChoices in November of 2013, all of these assessments are now completed using one tool, the MinChoices application, by a certified assessor, either a social worker or a public health nurse, as outlined per statute 256B.0911. When MinChoices was first implemented here in Ramsey County, there were certified assessors in both public health, where the public health nurses were located, and in social services, the social workers. In January of 2016, the MinChoices staff of public health merged together with the MinChoices staff of social services. It was at this time we began to form each team to be multidisciplinary. Each assessment team in MinChoices now has both social workers and public health nurses, and the supervisory team is comprised of both social workers and public health nurse clinicians. Over the past 5 years, there have been several shifts to our teams to help facilitate and ensure the most efficient process from intake to assessment completion. For example, we created a multidisciplinary consultation team to review assessments for our residents with complex health needs. We restructured our department and created a reassessment intake team to help facilitate a more efficient and trackable workflow. To access waivered services, our residents will need to be eligible for both medical assistance, long-term care consultation, and be certified disabled. On our next slide, Bridget will talk a bit more about our financial assistance services.
Thanks for that overview of waivers, Michelle. To be eligible for one of the waivers that Michelle just talked about, as she mentioned, the client must apply or be open to medical assistance and be certified disabled. There are multiple steps the financial worker must take to determine if the client is eligible for waivered services. The first thing that we look for is if the client is certified disabled. The reason that this is the first thing we look for is because it takes the longest time. There are two ways the client can be certified disabled. The first is through the Social Security Administration. Sometimes going this route can take up to 2 years for them to determine if the client is disabled. The second way is to go through the Department of Human Services, or DHS. DHS has a team called the State Medical Review Team, SMRT for short. This team gathers medical documents from clients' providers to determine if the client is disabled. Currently, the SMRT process is taking an average of 4 months for processing. Typically, when a client wants to apply for a waiver, MinChoices determines if they qualify for a waiver, and then an application gets submitted to our department. There are times that the client will complete an application, and we have to let them know that a MinChoices assessment is needed. Once the application is submitted, the worker sends the client a letter listing the verifications that are needed to process the application. We are also noticing that about 90% of the clients that are applying for a waiver are already open in the METS or MinSure system. This system does not look at assets to determine eligibility. However, when the client applies for a waiver, we need to verify assets and determine that they are under an asset limit of $3,000. We communicate this information over to social services so they can try and assist the client in returning these verifications. In addition to the assets, we also need a form signed by the client that is called authorization to obtain financial information from the Account Validation Service, or AVS for short. DHS put this process into place in 2018. This form is signed by the client so we can see if they have any additional assets that they did not report on the application. Once this form is received, we enter the information into a system and wait 10 days for the information to come back before we can proceed. If information is returned they have not verified, then we need to request additional information before we can determine eligibility. There are also times that a client is over the asset limit, and we must give them time to reduce assets if they want to proceed with the waiver. Some clients don't want to reduce their assets, so their applications are denied accordingly. The application can pen for 45 days, and the worker has to make a determination within that time period. Although applications can pen for 45 days, if there are delays on the state or county end, applications can pen for longer than the 45 days. For example, if the SMRT is delayed for some reason. Once all the verifications are received, including what the client sent in and from other systems that we have to check with, eligibility is determined. As noted above, most of the clients are already open on the MET system. So then we have to request DHS to close the MET's case. We can then code the system with the waiver. This can add a few days onto our process for system coding. Next slide, please.
MinChoices has clear statutory requirements. According to Minnesota Statute 256B.0911, persons requesting an assessment, service planning, or other assistance intended to support community-based living, including persons who need an assessment in order to determine waiver or alternative care program eligibility, must be visited by a long-term care consultation team within 20 calendar days after the date on which that assessment was requested or recommended. It also states that lead agencies shall use certified assessors to conduct that assessment. For a person with complex healthcare needs, a public health nurse or a registered nurse from the team must be consulted. The certified assessor and the individuals responsible for developing the coordinated service and support plan must complete the community support plan and the coordinated service and support plan no more than 60 calendar days from the assessment visit. If waivered services are not opened by the 60th day from assessment, an eligibility update, which is a phone assessment, needs to be completed between days 61 and 90. After the eligibility update, if waivered services are still not opened by the 120th day from that assessment, a new assessment is needed. This is where strategic partnerships become critical, and Maria will talk more about those partnerships.
Thanks, Michelle. So we're trying to pace ourselves here, but as you can see, there are so many moving parts and key players for us to be successful at what it is we're charged to do, which is serve the residents. So in this slide, you'll see just some of the listings of the key players and key functions that contribute to us doing effective service delivery. There's clearly a lot of moving parts. And we have to achieve and sustain effective service delivery in terms of operations, as well as adhering to policy and program requirements across programming, which sometimes is competing. But over the years, we've grown to better understand that accessible and effective services require strategic partnerships, collaboration, transparency, and a systems-based approach to modernization. While we have to adhere clearly to very technical requirements, the key partners and business areas listed here have unique functions, and we have to have a really focused connection. And so we're on the precipice of an opportunity, although growing pains are likely to also be involved in this space. So we have an image of these functions that we're going to get to in a short while, but we wanted to list this out just so you can see some of the different players. As you've already heard, medical assistance, that function and responsibility lives in the financial assistance department. That's where you get the Medicaid determination. MinChoices lives in the social services department. That's where we get the determination for folks who may be eligible for waivered services. That middle ground is a newer term that folks might not be familiar with, but we're going to delve into that in just a little bit. And that's the interconnection between social services and financial assistance services, with key players sort of also connected tangentially to understanding and us really centering residents. Another piece that you'll hear about as we proceed is from systems modernization opportunities. There's operations and mechanics underneath all of these program requirements, whether it's touching on the scan center, workflow processes, and then really trying to be more human-centered in our design as we go down this path. And we are also positioning to be truly in partnership. While DHS is an authority over sort of programming, they also have to be a partner. And so working in partnership, whether it's contributing to various work groups, and then also leaning into our lead agency, function, and going through lead agency reviews, depending on DHS for the SMART determination around being certified disabled for residents. And then something that you'll also hear about is this revised MinChoices tool. About 5 years ago, there were some tweaks and revisions, and now we're also on the cusp of a new tool being revised and rolled out, and some of the opportunities that come with that, as well as some of the challenges that will come with that. And then I would be remiss if I didn't mention that we need to do this in partnership with those who experience our systems. And for the most part, our area has been trying to connect strategically and intentionally with our citizens, our community advisory councils. And so with that, I'm going to pass it over to my team. I think Nashua is going to jump us off from here.
Thank you, Maria. So as Maria has mentioned in the previous slide, we have a middle ground team. To give you a little background, we have created a middle ground to help remove barriers for residents that need waiver services. Historically, we have denied waiver services for residents that were not on medical assistance for long-term care services, or those residents that needed to get disability certification through the state medical review team. These are both eligibility requirements for accessing waiver services. So in creating a middle ground team, we have asked our assessors to assist families with the medical assistance long-term care application and send a communication form to our financial assistance department to initiate the request for the disability certification. So while our residents wait for these eligibility requirements to be processed, our assessors then send these cases to our middle ground team. The cases then continue to be monitored so that when the barriers are lifted, the next step of opening the waiver will then happen. This change in how we provide services aims to remove a huge barrier for our residents, prevent residents from falling through the cracks, and helps ensure that services are open timely. We are working through maintenance and capacity constraints collectively to sustain and improve this effort. I'll let Bridget add.
Thanks, Nasro. I'd like to share a few examples of how FAS collaborates with Middle Ground. We have a dedicated financial worker 3 that is a liaison between our departments. The liaison has access to FAS systems and can take action on cases when needed. We have a team site set up so we can share information in real time to share updates that we make on cases. We also have developed an escalation process when either department is not getting a timely response. Next slide, please. An example of a collaborative service delivery, we're in constant communication with the social services worker for verifications that are needed, also with the client authorized and the authorized representative. We are also in the process of setting up a centralized group of workers who are going to focus on getting these cases set up. Next slide, please.
Okay, I think this is me. So this is a lot of nuance and a lot of detail, and we tried to capture it in a picture. I mean, first and foremost, we need to center families with elders, children, and adults who have disabilities. We know that there's a functional role with our Medicaid eligibility process in Ramsey County, whether it's MNsure, METS, or Maxis, but there's some technical pieces that need to be done there. There's certain authorities we need to adhere to. And then on the MnChoices side, we've talked about that as well. Also very technical and various authorities we need to adhere to. This middle ground is the connector piece, and then we have the players surrounding it. If you look at the Health and Wellness Service Team collaboration box, that's an effort that we're excited about because it's something that we haven't had the opportunity to leverage before, and we're going to talk more about that. But here's where I'm going to sort of say pause, and I look to Madam Chair and others to see if there's more that we want to go through or discuss. We're close to halfway through.
There is a lot here, and I think if nothing else, you've communicated the complexity of these systems and how people get trapped in them, and how we are limited by the statutory requirements and the other agencies that need to do their work to move forward. I do see a question from Commissioner Mattis Castillo.
Thank you, Madam Chair. Just one question. This visual is really helpful, and I like that you've created this middle ground to kind of keep things moving. I just want to be clear that you are showing us essentially back of the house processes, and at what point or what is the intersection that our families or individuals with disabilities are connecting into?
Thank you, Madam Chair, Commissioner Matas Castillo. That's an excellent question. And if I'm going to be completely honest, it can be either end of this process. And it can be somebody who's on waivered services who has a change in circumstance as such that needs to kind of get communicated back over to FAS and some action needs to take place. Or it can be somebody who's already on Medicaid, but then has a life situation or needs more supports and wants to stay in community, at which point MinChoices has a touch point and we would have to do a determination for waivered services. And that's exactly what we want to really delve into as we embark on 2022 with our systems modernization effort. And I was going to address it further in the slide, but one of the things I would share is we are just now, and me in this role, trying to delve into data so that we can make data informed decisions of proportionality of where are the residents most getting potentially hitting hiccups or getting experiencing barriers. And then with that data, not only quantitative data that we use from clunky systems, but also user experience and lived experiences and stories that we're hearing to delve into that to make sure we're solving the right problem. And that's where we're at. And this is sort of just the entry point to a lot more work that has to happen and that we hope to stay in connection with you all about. I'll pause there and see if others in the room have comments or responses to that question.
It doesn't look like there were any more comments on that question, but Commissioner Reinhardt has raised her hand. So go ahead, Commissioner.
Thank you, Commissioner Frotham. I just wanted to comment that this has been a long time, as you commented actually at the beginning. This has been around for a while and trying to figure out how to do this. And one of the things that I am really impressed with is, and it kind of goes to Commissioner Matas Castillo's question, what has always been in the forefront is how do we get the services to the people who really need them, and how do we make that as easy as possible, because in most cases people are in crisis. And I just remember back, and we were trying to figure out how all of this was going to fit together, and to see it now on a piece of paper and know all of the workings that happen in between and all around the boxes that are on this screen is very impressive, because it was new territory for everyone, and trying to figure that out. And that middle ground collaboration obviously is key to all of it, because these parts were, some of the parts were there before, some of them weren't, but trying to track that and trying to make it the best outcome for our constituents was, at the time anyhow, we thought it was going to be not easy to do, but this is impressive. And so I just want to comment on how much we know has to happen in the background for each individual and each family. Thank you.
Thank you, Commissioner Reinhardt. If there are additional questions, we can keep moving forward. And at this phase in the presentation, if commissioners have questions that come up, we can take them at the end of each slide if necessary.
Thank you, Madam Chair. Yeah, thank you for your comments. I mean, we're definitely still in the throes of it, and we are working to leverage the service team model to get to better outcomes and serve residents. The key takeaway here is that strategic partnership and collaboration is a requirement for us to be successful. With that, we can go to the next slide, and I'm going to pass it over to Michelle.
Thank you, Maria. Nasser and I will both be speaking to this slide, but I'll get us started here. So Ramsey County is the second most populous state in county in Minnesota. Many of our residents present with 2 or more diagnoses and have a need for home and community-based services. COVID-19 has had various impacts to our service delivery as well as our residents' needs. We have had to pivot and shift the way we do our work. What once was exclusively face-to-face in-person assessments shifted to virtual only for a period of time. And currently we're operating under a hybrid model of in-person or virtual assessments, whichever fits the residents' needs and promotes health and safety. Virtual assessments require us to mail signature documents to the residents. We then monitor and track for the return of these documents so services can be opened. We have also noticed that during COVID-19, hospitals and nursing facilities are at or near capacity, which has been increasing the need to move residents back to the community quickly to open up those beds.
As you all know, we have been providing mean choice assessment since November of 2013. As we become more known to the community, we receive more requests for assessments and surfaces. The initial assessment requests that we received this year will increase the number of reassessments we will need to complete in the following years. Maria will now talk about the increase of utilization of home and community-based services in the next slide.
Thank you. So, as I'm alluding to and trying to drive home, we are just now beginning to dig into data. We want to make more data-informed decisions. We want to be able to do a retrospective analysis. We want to be able to make projections on how perhaps staffing shifts will impact service delivery. We want to make informed decisions. So we want to leverage our data and be in our reporting, but at a high level, and I have just one other data point that I'll bring to you yet today, but remember, our data is either internal data, sometimes it's systems data, such as SSIS, which is Social Service Information System, that's a state system. Sometimes it's DHS warehouse data, and then sometimes it's data we're tracking on spreadsheets. So we're digging into this now to be more refined and to do some of this data analysis more regularly and with more precision. But at a high level, we know that in 2018, we pulled some data for the board. And at that time, there were 11,500 residents who were on waivered services and received personal care assistance. In 2021, at the end of this past December, we pulled the data, and we now know that there's 15,744 residents who are on waivered services and receive personal care assistance. This is a 36.9% increase in just a few years. So we need to be cognizant of the shifts and the needs that are growing, and also couple that with not veering without being purely driven by numerical data, but also tapping into that qualitative and anecdotal data that we know from people who experience our systems, again, to co-create solutions and share power and decision-making for our more human-centered systems modernization and program enhancements. Along those lines, we also want to tap into the experiences and knowledge that our staff and workforce have, whether it's internal staff or external staff who are in the day-to-day work and supporting residents to stay in communities and live with loved ones. And the last thing I'll touch on is that we also know that we are serving more racially and ethnically diverse populations. And there's an uptick in that. And so again, really leveraging our relationships and our connections with all the entities that hold our data, but also internally with the Health and Wellness Administration area to be more precise with understanding and using our data to make informed decisions. So now I'm going to pass it over to Michelle and Nasro, who will explain this increase in utilization and how it's impacting us in terms of backlogs and frankly delays.
Can we pause for a moment? Commissioner Carter's got her hand raised.
Thank you. I really appreciate hearing you say as we become more known to the community. That certainly rings very, very favorably in all of our ears, because we do know that there are many families and individuals who could qualify, who go without qualifying. So to know of the work that you're doing in making those connections to expedite or to remove barriers to eligibility is great. I recall a couple of years ago, maybe a few years ago, there was a response from Health and Wellness and Human Services, I believe. Financial assistance must have been involved as well, to send out an individual to meet with a church that was focused on the need for new connections. People simply did not know how to get services or were struggling in families to support individuals within their homes. And there were a number of connections made from that outreach. Can you tell me, in addition to our CAC and also, of course, the new connections that are being made for us coming from hospitals or care facilities, how we are reaching out? And I, almost shudder to ask the question. I know there's enough work to be done, but certainly to achieve a greater utilization in communities of color, for example. We know the great utilization that has happened and the imbalance between voluntary and voluntary services in the past. And we certainly want to make sure, with our focus on equity, that we are able to continue achieving that greater utilization. So thank you for mentioning it. And can you tell me if we are engaging people in new ways? I appreciate the CAC and the greater engagement there, but are there new ways as well?
Madam Chair, Commissioner Carter, I can speak to that from the Social Services Department perspective, and then might pass it on to our FAS partners as well. And what we are doing is, in terms of our infrastructure as a county, we're better positioned to do more community engagement activities. There's more funding available to connect with partners, to do more sort of informal connections. We are in a space where we need to start planning for that more intentional and focused connection to ensure that we honor folks' time and compensate them for their lived experience and expertise. And so we have some seedlings that we're nurturing, but definitely room to grow in that space. And I love the call out for our faith-based communities and our more grassroots organizations. I think there's lots of opportunity to do that. And we do look towards doing that, and we'll come up with a better strategy, I think, and then we could always come back and report on that. And we'd love to hear ideas from people as well. So that is a priority, and it's really important for me. And that's on the plan. That's part of the plan in the coming year.
Really good to know.
Thank you.
Thank you.
Thank you, Commissioner Carter. And got your hand down now. Yeah, and I think that's a great point. The outreach, there's obviously a need, and maybe an untapped need that was came out during the pandemic. I think the next slide, as we talk about backlogs and waiting lists, indicate why getting our internal processes in place first is probably step one before we bring more people, intentionally seek out more people to enter the program.
Next slide, please.
Thank you. In MnChoices, we currently have a waiting list to be assessed. Initial assessments are for residents who do not have active services in place. And as of December 30th, we had 33 residents from our elderly population waiting to be assessed. And for our under the age of 65 residents, we had 236 residents waiting to be assessed. In our middle ground, we have 145 residents who have had a MnChoices assessment that are waiting to be open to waivered services once one of the barriers or multiple barriers are removed, such as obtaining medical assistance for long-term care. We currently have 137 residents that need an eligibility update. These are individuals whose assessments have expired, and we will need to do a phone assessment to extend the assessment timeline. These assessments have some barriers, as mentioned earlier, such as medical assistance or disability certifications, which is why waivered services were not open before the assessment expired. I'm going to hand it over to Nasra, and she's going to add a little bit more information here.
Thank you, Michelle. We currently contract out reassessments when the only service in place is personal care assistance or consumer support grant. The consumer support grant program gives families greater flexibility and freedom of choice in service selection. These are medical assistance state plan services, which means there is no case manager in place. This reassessment only assesses for personal care assistance or consumer support grant. In situations where a resident wants additional services such as waiver services, they have to come back to the county again to be reassessed for all services using the comprehensive MnChoice assessment tool. DHS has communicated with counties that all of these assessments need to be folded into MnChoices with the implementation of the revised MnChoices tool. In 2021, approximately 4,300 assessments were completed by our personal care assistance agencies that we contract with. Maria will now talk about workforce considerations in the next slide.
Thank you. So just to drive home, we're doing what you may have heard the term legacy assessments, and that's a more narrowed assessment for folks. We're at a cross point where we need to bring those 4.3K individuals who are just getting the legacy assessment into our operations and into our programming as a county, and ensure that residents are offered the full MnChoices assessment, which may be an increase in services, better supports to stay in community. And with that, and we're statutorily required to do that. At the same time, what does that mean for us in terms of workforce implications? And folks who are on waivered services also get case management services. And so we do case management services for Ramsey County case management, as well as contracted case management. And again, just high level data to show what the spread is in terms of how much case management we contract out versus how much case management we do internally, and then really understanding the market around what services are available, which services are, maybe some entities may do really great work and we lean on them more, or maybe we need to hone in and do more focused case management work as a county. And so we're exploring this. We're just beginning to explore it. And at face value, we've also been talking to other counties, particularly in the metro, and looking at their spread for contracted case management versus internal case management. And because we're so densely populated, our 72%, for example, is significantly more than a smaller county's 72% in terms of residents as well as staffing. And so again, there's lots of opportunity to dig into the data and do some analysis and comparables. And that's what we aim to do as we enter into this next year and position ourselves to meet the needs that are emerging. On average, just for a slice of tidbit, is each case manager that we have, whether contracted or internal, has up to 45 to 50 cases that they manage. And so this is a heavy lift, and folks are in the day-to-day, every day, serving our residents. The next slide is the exact same information, but in a bar graph, which I like because I'm more visual, but you can see that we contract out more. So, and that partner agencies are providing those services, and our internal contracted case managers have a lower volume of work that they're doing. Yet and still, we're looking at ways to balance this out and be strategic with resources that we already have. And I'll pause there.
Thanks. We do have a couple of questions. Can I just get some clarification? So what what I took this to mean is there are a lot of contracted case managers, so outside agencies that do the PCA assessments when they're not expected to be on the min choices or not to have a waiver. But now all of those assessments also need to go through the full min choices assessment, which is done internally.
That's correct. And we will be in relationship to work towards that objective with DHS, knowing that we're not going to be able to do it overnight, but we need to come up with a plan and a strategy to be able to position ourselves for that. That's
Right.
correct. Thank you,
All right.
Madam Chair.
That's a huge lift considering the existing backlogs. I think the first hand I saw was Commissioner McDonough, then Commissioner Manis-Castillo, then Commissioner Reinhardt.
Yep, Chair Fressum. My question's on 2 slides back, please, if you could go back 2 slides. Yeah, so can you give me I got 2 questions on this slide. First, on the backlogs and the waiting list of the 33 and the 236. Give me a sense of how long folks are waiting on waiting lists or backlogs to get, at least the process started for themselves.
Madam Chair, Commissioner McDonough, I'm going to lob that over to Michelle Cush, if you could speak to us. I know that there's connections in terms of our scan center and mechanics of how we're able to absorb various proofs and verifications that play into this, but Michelle and maybe Bridget also might want to chime in.
Thank you, Maria. Madam Chair, Commissioner McDonough. So currently our backlog, looking at a time frame, is generally speaking about 7 weeks ago. So people that we're assessing now called us 7 weeks ago. So the beginning of December. We do have a process that we utilize for priority assessments though. So for example, if we have residents who are trying to return to the community from an institution, or if we have residents who had waivered services that closed because they were institutionalized for more than 30 days, certain other scenarios that have been deemed as priority assessments where those residents move to the front of the list. So they don't necessarily, all residents don't necessarily wait the full time, but every time we receive a priority case, then of course it pushes other people back.
Yeah. So that seems like a long time to me, but I'm looking to you and Maria, your team. I mean, what would be your goal? What do you think is appropriate for a resident or a family or an individual to be waiting to get through this process?
We'd love to go ahead, Michelle. My apologies.
Sorry, Maria. I can definitely speak to that. So statute states that we need to perform that assessment within 20 calendar days of them requesting that assessment or an assessment being recommended. So I think I can speak for all of us here. We want those assessments done as soon as possible. And we would like to have them done, worst case scenario, within that 20 calendar days of when they've contacted us. And so that's the goal that we're aiming for.
And right now at 7+ weeks, we're almost 2.5 times that. All right, and then a question on the eligibility updates needed, 137 cases. Is this where the 90-day was triggered, where we didn't get everything done in 90 days, and then we kind of had to go back and do some things and catch up? And give me some examples of why we couldn't get, why we've got so many cases where we're not getting the stuff done in the 90 days. I mean, am I accurate in saying I could put this together, right? They waited potentially 7 or 8 weeks just to get into the process. And now we're 90 days on top of that. And now you're coming back to reassess them because we didn't get things done. It's a little discouraging. And I know you guys know this, and I know you don't want it to be that way. And that's why you're having this conversation with us for solutions. But it is a little discouraging. I think you guys all know, I mean, Carol and I You know, we have Peggy with us, and we've been through this. You know, for 25 years, we've been her legal guardians, and threading these needles is frustrating, and we're very savvy on it. And I just feel for the people that either don't have the time, the inclination, or the understanding to be able to help thread these needles. And then you start compounding, you know, these delays on top of all the confusion. It can just get discouraging to the point where they just, you know, do the best they can with what they got. So I digress. I'm sorry, I did have a question. So the 137, we go back in there that we missed the 90 days of trying to get everything done. Give me a sense of what's going on why we missed the 90 days. And then how much more time is piled on top of these cases to get them actually to a decision point where they're actually getting services?
I think from a financial assistance aspect, it comes in on when we get the information from the Min Choices assessment and when the client actually applies. There are some assessors that try and help the client complete that paperwork. Some assessors mail the paperwork to the client and leave it to them to try and get the information to FAS. So there's sometimes a delay in getting that application to us and putting that all together, and then seeing where they're at with measuring up to all of the systems that we have to do, like if they need a SMRT, if they need the AVS form, and they turn in the application, they haven't turned in that AVS form. There's all of these delays along the way that can lead to why they haven't, why they've had to do this eligibility update and that waiting process that they're in.
Mm-hmm.
Before we get to the other questions, I think County Manager Ryan might have a comment on this as well.
Thank you, Madam Chair. I want to build a little on Commissioner McDonough's question, just in case it's a point that helps us better understand some of the current spot and the cycle we're in. And Commissioner, your words are well taken on the frustration with it and where we're trying to get our heads around it. In 2017, when we were with the board talking Min Choices, at that time, we were facing some pretty significant funding shifts that came on counties as a part of how the budget got balanced. And I'm sure most of the board remembers those conversations and the frustration that came with it. And the concern at the time was around the idea that those cuts, when not aligned with changes to how assessments or reassessments were allowed to be conducted, would lead toward a space in which backlogs got worse. And we were concerned of that then and engaged in a process with DHS to try and address the inefficiencies in the program that really didn't result in any kind of tangible outcomes to changes to the process. I'm just curious, have the funding changes that occurred when the rates got changed impacted what we're seeing now, or am I just barking up the wrong tree and that's really not what it's about?
Madam Chair, County Manager O'Connor, I will own the fact that I believe there's much more budget disentanglement that has to happen at a program level, at which point we could analyze brass codes, we could look reimbursement rates, we can determine what the costs are based on the type of work that we're doing per the DHS sort of random moments process. And I'm not super steeped in that area, but that is our intention, to disentangle more of that and find more information. I'm not sure if Ann Berry's in the room, but we might have some other leaders in the room who could speak to that.
With your permission, Commissioner Fretham.
Go for it, Ann.
Thank you, Commissioner. And Ryan, to your point, those funding reductions were not matched by DHS with tool changes that allowed us to be more efficient and to do our work better. So the promise that was to come out of that budget reduction during the legislative session was, well, we can reduce the funding because we're going to make it easier for you. The funding was removed. I don't think anybody here at the county level would say that the process got any easier or improved. So I think that was your question. the marriage that needed to take place between funding reductions and efficiencies at DHS, we lost on that end, you know,
Yep.
on that end of the
Yep.
bargain.
Thank
Yeah.
you. And I don't.
Is
I
that
don't
your
wanna go into-
question?
Yep.
Yeah.
No, and I remember that quite well. And you know, I think it's important for staff for you to know. I mean, Ryan and I sat in Senator Abler's office for 40 minutes arguing with him why we needed to simplify this, why we needed their help in some legislative changes that were occurring back then in 2017 that we knew was going to make it not only more costly, but more difficult. And I appreciate your follow-up question, Ryan, because I never really did get the, you know, close the loop. I know he wasn't receptive at the time for some of the changes we were advocating for, but, you know, trying to connect the dots on the funding and did we get some relief in that way that maybe helped us, but it doesn't seem like that, you know, with Ann's response, that's really helped us out here much at all either. So thanks, Madam Chair.
Thank you, Commissioner McDonough. Commissioner Mattis Castillo is next, and then Commissioner Reinhardt.
Thank you, Madam Chair. You know, I think each slide now like unravels the system's problems. And I know you're really diving into it. I just want to call out that, you know, as we're talking about PCA assessments, there's a tremendous shortage of PCAs. So even if we can get someone assessed to get them qualified to have a PCA, there's no PCAs available. And not only with COVID, there's a shortage pre-COVID, now it's in crisis. They're just not available for folks. So thinking about how we can encourage families who might be able to care for a loved one and receive payment to be in that, you know, kind of become the caregiver, but also be able to afford it is really critical. Our legislative agenda is full of things that need to be fixed at DHS, and I think every one of these slides really elevates, you know, the need for more PCAs, that they're paid better, you know, all those systems in place. I do have a question, and that is when you're talking about contracted case management outside the agency, because, you know, as a customer, a client of Ramsey County, whether they're an outside or inside case manager, they just say my county case manager, right? And there, as you alluded to, Maria, there might be differences and, you know, some are better than others. Is there a standardized, or are you moving to a standardized, at least county level training for those case managers so that we know that those doing that work align with our values in our approach in the way we do work? And then also, do those case managers have access to your middle ground kind of fixers as well to make sure things are flowing?
Thank you, Madam Chair. Commissioner Fretham. Yes, that is another enhancement. Starting boots on the ground. I've been in this position for a short while, but that is one of the priorities, is to level set learning and development and training, not only for our internal case managers, but external case management is too, to make sure that there's uniformity. We did launch one recent training that was all the contracted case managers and internal case managers, just to level set on the racial equity piece and our mission and our vision and our values, and how that connects to, if you're going to do business with Ramsey County, here's a level set expectations of what that means. That was a high level, and one of the first things that I made sure was done. And then as we get into more technical pieces, we're developing a calendar for 2022 and beyond. We've done a survey to see what folks want to know more about, not only from case manager perspective, but as well as what residents, listening to residents who are receiving services and where they feel like there may be gaps in terms of the service delivery that they're receiving. So that is work in process for sure. And we have a whole team that is working towards onboarding contracted case managers, and that lift is actually happening now and to be rolled out shortly. I'll pause there. Thank you.
Thank you. I think our last, there's a question from Commissioner Reinhardt, and then we'll get to Commissioner Carter, and then we do have 7 more slides after this.
Okay, thank you. Looking at this page and then going to page, well, I think it's page 17 anyhow, the workforce considerations, the bar chart that you had up. I had a couple of questions on this because you might want to pull up the chart. That one, yes, thank you. Clearly, you know, about on average, I guess it's about 25% that's done internal and the rest is done outside, and maybe a little bit, you know, around the edges there. But that just shows the number of cases. What I'm wondering about is the efficacy. In other words, you know, do we take, when it's internal, do we take less time, more time? How does that work? And then because I guess I'm looking at it and going, okay, why do we have such a backlog? Is it because of the internal, or is it potentially with the contracted cases, or is it just playing too many cases and not having enough staff, whether it's contracted or internal, to take care of it? And then, as was pointed out by Commissioner Matas-Castillo, even if they do get through this process, it doesn't mean they're going to be able to find a PCA to help them. And then on a separate question is, I know that when COVID first, when there were some changes that we were making at the legislature that were temporary, that we wanted to have made longer term. And I don't think they were, even though we're still in COVID, I don't think that they were, that they continued. Is there anything that we could do regarding some of the reporting requirements, or is this just all at the beginning stages, even before you get a PCA? So I'm trying to figure out where there's more efficiency in getting through them, but also if there's something that, you know, reporting requirements, had they been, you know, every 6 months and a year was fine, or whatever it might be. So some of the things that we could do to try to solve this, whether it be more internal or contracted case management. I'm trying to get a handle on that.
Madam Chair, Commissioner Reinhardt. Thank you.
Yes.
Okay. So I will say that this board graciously helped us create space where we could extend contracted case management contracts that were up for expiration, at which point that got us time to have a participatory process for residents who experience our systems to contribute to a review process for new contracted case management just in the last month or so. And the specs for those contracts are what really hone in our service delivery requirements, and they mirror that of the requirements in terms of management services, whether they're internal or external. It's the same menu of supports and the same criteria. So I'm hoping that touches on the efficacy portion of the question. We recently went through a process where we're bringing in more contracted case management as well. And so that is something that we are aware of. And as we shift and pivot, again, the onboarding piece is really key for us to make sure that the case managers have the onboarding and have the understanding of what the expectations are, reiterated through the agreements that we've all came to terms with in terms of the RFP process. That's one piece. And then I'm trying to hone in on the backlog question piece. I think the numbers and the volume and the connections between the eligibility determinant for min choices, which is one piece, versus the eligibility determination for the correct MA, which is MADX, MA for folks who have certified disability. That is where we're losing some ground. And that, I think, is what's contributing to the delays. And if we go to some of the up and coming slides that are in the packet, I'm hoping that we can touch on that and expand more on how we want to be more solution oriented and address the things that we know aren't working. I'll pause there. And I would also just offer, this is a lot of information and it's very complex and nuanced. So we could aim to be in connection and can always circle back if we're not able to answer all of the questions that are presented today, and we can have more walkarounds and follow-ups as well.
Thank you. So it sounds to me like whether it's internal or contracted services, there isn't one that's, because they're treated the same, you're going to have the same numbers, getting through the same numbers and trying to make sure the services are equal. So for the person that's applying, it's seamless.
That is the intent, Madam Chair, Commissioner Reinhardt.
Okay. And then as far as what percentage, let's assume you get through this whole process, what percentage of the folks that have applied for services actually get services? Or is there something that knocks them out? And they say, okay, you went through all this, but you know what, you don't quite qualify.
That's an excellent question. And that is the type of data that I want to leverage to make informed decisions about where we might need to improve. I can't give you that answer at this time now, but I'm pressing for that answer, trust me.
All right, thank you very much.
Madam Chair, Commissioner, this is Bridget. I can somewhat answer that, and I hope to get to that a little bit here in the slides coming up. But some of that has to do with the client not realizing that there's different income guidelines and that they, may have a spend down, which gets into really complicated policy, or that they don't realize that there's a $3,000 asset limit because they're already open on the MET system that doesn't have an asset piece or component. So some of that we're seeing where clients just don't want that, and why we're denying the case. I don't think that we see very many clients where they're not meeting that disability requirement. Sometimes we do, but I think it comes down to mostly income and assets.
Thank you. And do you have anything you want to add to that before we start moving on to the next slides?
Yes, thank you, Madam Chair. I also want to remind people of our budget presentation where we do lay out the data and demonstrate the disparities that exist in approval for people who get waivered services. So white families have an almost 90% chance of getting on a waiver, where African American and American Indian children and families are much lower, well below 50%. So we know there's some serious disparities that are also being worked on, and why, if it's an issue around finances and assets, if that's the issue, I don't think so. I think there's probably bias in the way we make determinations about who is eligible and who else is in the household. So, I mean, there's a lot of, as Maria said, this is complicated and layered, and there's just so many pieces we'll have to take apart. But part of our budget performance measures is around reducing those disparities and getting underneath and understanding why it is that particularly African American and American Indian families who would otherwise be eligible for waivers are not getting on the waivers.
Thank you. Let's move to the next slides to have this solution-oriented conversation.
Thank you, Madam Chair. This is Jennifer Schuster-Yeager. I'm the Interim Director of Health and Wellness Administration. And I am really thrilled to be here talking about technology along with the business, because so often when we talk about technology, we talk about it as it's a thing that exists apart from the business. But really, we are here to talk about how now technology supports all these business changes that you've been hearing about from social services and financial assistance. And this is one of the, you all will remember, we've talked about human services modernization. We've made a substantial financial investment planned for 2022 to support human services modernization. And this is going to be one of the first projects out of the gate, is trying to support all these changes that you're hearing about today. So some of the goals we have is this culture shift, right? Where we're working together, where we have that middle ground, and that middle ground is supported by technology. So we're changing how we do business, we're changing how we work together, and then we change our technology along with that to use the systems and tools that we have. So we will be using SSIS, and we will be using METS and Maxis and Laserfiche and all the systems the county owns, but we'll be trying to configure them and set them up in a way so that we're better serving residents. We have better measurement, and we are able to meet all the goals, the operational goals that you've just talked about, and the goals that we have for residents. We're also going to be using human-centered design. And I think, Commissioner McDonough talked a lot about that, about like, what does this actually look like from the perspective of the people who are getting services? What does it feel like? And then what can we do to take the complexity out of this system? So the county is investing in modernization, which is some of that foundational excellence we've been talking about, and that we will be using to apply to all these changes to hopefully support the changes, support the reporting, support the fiscal reporting, and also support disentangling the budgets so that Maria will know what's happening in her area, what she's spending, how much is she can see her budget alone separate and understand those budget dynamics. So that's some of the administrative pieces that are underneath this middle ground, that are underneath all the changes that you've heard, and that tie into residents first. And so we'll be working closely. We have our new program manager on board for modernization, Lori Forner. I think she's listening today. So she's really getting a good grounding in what this board wants with our modernization, with our human services modernization, and with this project. And we'll be working closely with Maria and Ann and Tina and Bridget and everyone else on this call to really set that vision, and then to bring the technology in to support that and to use the tools that we have. So that's how system modernization fits in here to me. It's part of how these pieces fit together, and that we are another important collaboration in this drive to improve services. Next slide.
So following what Jennifer was saying, we believe that systems modernization will highlight the steps that FAS has to complete. So we have knowledge on both timelines, so we can help determine where our pain points are and where we can work better together. Next slide.
Thank you. And the purpose of this slide is just to show that it's a priority for our area as well. And my real takeaway is that maybe in 2017, we may have come to you as a program, MinChoices, and this is what was happening, but we're coming to you now in unison with the Health and Wellness Service team, because this is not just a Social Services Department issue. It's not just an FAS issue, but we need to work on it collectively together and be clear about our functional roles and responsibilities. The personal care assistant assessments, the legacy piece is going to be a pressing issue for us going forward. And then also, as Jennifer Schuster-Yeager mentioned, exploring the mechanisms of how we're doing our work. Where is the redundancy? Where is the gaps? And how do we move forward? In 2022, the revised MinChoices tool, one of the things I would add is, while we're a little bit anxious about it, we understand that it'll be more conversational, and it may be less time consuming and more efficient for the resident. However, the administrative back end work of it and the technical pieces may have some tweaks to work out. There's a training zone that we have all of our folks engaged in, and it seems to be more user friendly and less invasive for the resident, as they have to go through reassessments every time somebody is assessed for waivered services. And we are engaged in a pilot, and there's some implementation dates that kind of keep getting kicked down the road, but we are closely watching this and staying connected to it as best we can. And so there's some more decisions that need to be made about how this will roll out, but we are cautiously optimistic and excited about the resident facing advantages to the new tool. And we have to take all of these systems pieces in play while they're not within our control. As we go down the county systems modernization piece, there might be stop gaps that we can incorporate into our efforts in a strategic and holistic manner. And that's something that I'm looking forward to. If we go to the next slide, this is us trying to summarize many of the challenges as well as opportunities that we have touched on today, and that we can continue to dig into. And if I had any sort of takeaway, it would really be that we know these are complex systems. Our role is to decrease the barriers, increase access for our residents. We have a role and responsibility to do that, and we have to position ourselves to do it. it's work that is heavy, and yet it's really important and central. We also know that the workforce who are on the front ends in the day-to-day work face some barriers that we need to alleviate as well, so they can feel good about their work, so that they can continue to serve residents, and that residents are able to stay in communities with families and loved ones. I am excited about this budget disentanglement and the further down programmatic in terms of understanding brass codes and reimbursement rates for certain services and so forth. I think there's a ton of opportunity there. And also strengthening the other pieces that we've talked about. I'm scared to touch my computer because it might shut down. Okay. Leveraging contracted case management and, you know, and the underpinnings of this is we're in a pandemic and there's lots of changes. We've changed the way we do work. We've changed the way we talk about our work, and wanting to also support folks to be engaged and solicit feedback, ideas, and opportunities to do things differently to get better outcomes and decrease the backlogs and diminish the waiting list. That's why we're here. It's a moment in which we're being truth tellers so that you all can help us be accountable, our residents can help us be accountable, and folks help us get to the other side of that. And again, the last thing is about engaging with community, being participatory. I was remiss in not mentioning that we have sat out and done like tabling at different events in the community, but being more strategic and planful around that, and connecting with communities to be part of this co-governance and participatory process. That's what I have. I'll pause here. I think there's might be a question, Madam Chair.
Yes, we do. We do have some opportunities and challenges from the financial assistance team. So just noting that there are a few more slides to get to, and we're approaching our time limit with your questions. So I'll start with Commissioner McDonough.
Thanks, Madam Chair. So I just want to make sure I'm understanding this slide here. The way I'm reading this is part of the proposal or the intention here moving forward is to move away from contracted services and increase the county direct or county employee services. Am I reading that right, or am I seeing that right?
Madam Chair, Commissioner McDonough, we do need to look at staffing adjustments. There's a chance that we may need to lean more so on contracted case management, and then be more lean and focused on what our current case management workforce is doing. I'm soliciting feedback from supervisors, managers, and employees to see what that looks like and what the possibilities are. But there was a time in history where I think we took some teams who were focused only on case management and folded them in to rise to the occasion for the pressures that were upon us in the MnChoices arena, because only the state, only the county agency can be certified assessors. And if we were to do something different besides our own staff being MnChoices assessors, that would look that would require a lot more digging, and we are grappling with options. So I hope that answers your question.
Yeah, and still unclear here. I mean, the way I read, like legacy personnel care assistant assessments, 4,300 conducted by vendor agencies to be folded into county. So I'm reading that you're going to potentially move all those assessments that are currently being done under contracted agencies into county employees doing those assessments.
That is correct. And we would have to do some internal shifting likely to be able to pull that off, and also be in relationship to work towards that compliance requirement with DHS, and come up with a plan and a strategy to adhere to that expectation and that requirement. That
seems like a big move. And I go back to some of the questions Commissioner Reinhardt was trying to get at earlier, and maybe even a couple of the other commissioners, is really, and I didn't get a clear answer from you. And I think, actually the answer from you is you're still trying to sort that out. But I mean, Commissioner Reinhardt was really trying to, ask very specifically, do we sense that the backlogs and the delays are coming from the contracted side of this, or the county employee side of this? You know, your response was, you know, that's what you're trying to get at, but it seems like you're proposing solutions here before you really have the data on. I mean, what are you trying to accomplish? If you're trying to accomplish eliminating the barriers and then speeding this up, you haven't shown us, or at least talked to us about the fact that you believe the contracted agencies are the ones slowing this down or not performing at a level that would meet the community's expectations. And you're proposing a pretty big proposal here to, you know, shift from contracted services into county without, I would suggest the data to back it up that is the barrier, and that is a benefit that you would see from making this shift.
Can we just pause and confirm? My understanding was that the reason that those assessments are being moved to the county is because it's required by the state. It has nothing to do with the performance of those the contracted agencies.
Madam Chair, that's correct.
Yeah, so I think
So I thought the MNsure side of it is, but not the other side.
Madam Chair, Commissioner McDonough, the challenges that we're facing, and I'm saying this with a collaborative spirit, is before, when these presentations were brought to you, they were not brought to you in partnership with financial assistance services. We need to work in collaboration and alignment with financial assistance services to get through the backlog to activate waivered services. And that's the plan. And I would leave it to my superiors to speak to this in any more detail.
And I guess, you know, coming forward with the plan, I think is really important. We need that, you know, going back to the slide of the backlogs and the 7 weeks and missing 90-day windows and all that. It's just when we're proposing big changes versus, you know, contracted versus, you know, direct services, I go back to the questions Commissioner Reinhardt was trying to get at, is where, give us the data that would demonstrate that, you know, if we make this change, we think we can speed this up because we think the barrier is here. She was very specific with those questions, and nobody suggested that the issue really lied in whether it was contracted or not contracted.
well, and I don't think that's what's happening. Ann Barry's got her hand up, so I think she can clarify.
Thank you, Madam Chair. So we have contracted partners for both assessments and case management. So for the contracted partners who are now currently doing assessments for personal care services, that has to end. That's a state requirement. So we know we're going to have to shift some resources so that we can manage all of those assessments. What it means is we will have to lean heavier on our partners that do case management, and our staff that are currently in the department doing case management will have to shift to assessments to pick that up. So I don't think anybody is suggesting that the contracted partners who do personal care assessments are any slower or faster than we are. We just can't let contracted partners do that anymore. That's the state requirement. So we know we'll have to make that shift. So even if they were outperforming us, the state is saying you cannot use contractors anymore to do this assessment. Does that help get at the question? So if it sounded like we were suggesting the performance of our partners who do the assessments is worse than we're doing, I don't think we have the answer to that question. But in the end, the state is saying it doesn't matter. Assessments can only be done by certified assessors that exist in the county. And so we know to pick up all of these personal care attendant assessments, which will now be MnChoices assessments. We can no longer use this old system with our partners anymore. What Maria is saying is we're going to have to internally make some shifts in our staffing patterns to be able to pick up all these assessments.
All right, thank you.
Yep, and I think that's where, when we see on the opportunity side, the leverage, the contracted case management, that in order to make that balance shift, being able to leverage our partners that manage cases. Ryan, County Manager O'Connor's got his hand up.
Thanks, Madam Chair. I'll be brief. I want to make sure I understand this too, because it's extremely complex across the board. I appreciate the dialogue here. the legacy system has been allowed during a transition period to using min choices because it just couldn't roll out all at once. And what I'm hearing is now we've hit the point where the legacy system won't be allowed moving forward, and that's what creates the challenge. Is that a fair restatement of the current point in time? Okay, thank you. And so it is that part of like, the system didn't go full bore on day one in the state's rollout. Legacy systems were allowed to be a part of it. Now we are having the legacy systems removed going forward, which long-term is probably good, but in the short term creates your bullet challenge. And Anne and Maria, to your point, it impacts our case mix of where it sits, which is a question that does not actually address whether or not we should do more with the data, as Commissioners Reinhardt and McDonough asked. That's a follow-up for us to come back and talk to the board more about as we learn more.
Thank you, Ryan. Let's get to the financial assistance challenges and opportunities, and then we should be able to get through the next steps and have an opportunity to indicate areas for follow-up.
Thank you. This is Bridget. So we share some of the same challenges that Min Choices does. As mentioned earlier, if a resident is eligible for a waiver, the policy is more complex. There's more rules to determining if somebody is eligible for that versus just regular medical assistance. Their income and asset guidelines are different. There's multiple steps to determine eligibility. We're also trying to align the timelines that social services and FAS has, so we can shore up that a little bit easier. I'm just trying to summarize here a little bit. We have to wait for outside systems to do some coding for us. I would say that continues to be a delay for us. When we have cases that are active in the METS or MNsure system, we have to send an email to DHS to have them take action on that case, and then we have to code our system with the waiver. So that can be a challenge for us. Hiring and training staff also seems to be challenging because of the complex policy. It takes longer, and the procedures take longer for the case. So staffing continues to be a challenge. So next slide. Just wanted to kind of run through two typical case scenarios. Sometimes when a client is on medical assistance, they could have $1,500 per month in income. They're receiving PCA services, and now they need a waiver. The income limits are different for the waiver, so the worker has to explain what a spend down is. The client will then have a $600 per month spend down before medical assistance will make a payment to their providers. Sometimes clients don't want that, and they don't realize that that's what will happen when the waiver gets activated. The second scenario, kind of briefly touched on, is when a client is in the MET system and they don't look at assets, and now they need a waiver, and we're starting to look at assets. So that can be somewhat of a delay. And once we get all the asset verifications and need to tell them, now you need to reduce assets, and there's work on both ends for the department, depending on where they're at in that Min Choices assessment and the timeline. And then some of the opportunities that we have, we would like to do some staffing, look at some staffing resources that we have right now, similar to what Min Choices is looking at. We have workers kind of across the department in FAS, and so we're looking at aligning all of those workers that are in some other sections into one area and have one supervisor kind of be that go-to person to make sure that that work is being completed. We think that that's going to shore up some of the timeline issues that we're seeing, just with some of the spreadsheets that FAS and social services share. That seems to be where some of the errors and the delays are happening. So we believe that having them under one supervisor will make that process a little bit smoother. We also want to engage staff to solicit their suggestions on workflow changes as we move forward. And lastly, we're really looking forward to the systems modernization that Jennifer was speaking to. and next steps.
Thanks, Bridget. So here we just have a snapshot of what we aim to prioritize for the next 6 months and then through the biennium. As Ann Berry clarified, we will need to make strategic staffing adjustments, and we're open to discussing that more collaboratively within the department and within the division, and in unison and collaboration with the changes that Bridget's area needs to make. We continue to strive to reduce barriers and promote a more collaborative organizational culture. The systems modernization, again, being resident-centered and focusing on the user experience to drive any changes, to complement or offset any of the changes that are required and that are coming from the state. And we are hoping that that would be an excellent opportunity for us. And then I can't reiterate more that the budget planning and management, fiscal analysis, rate structures, revenue formulas, and our federal allocation are key data points that would help us make better business decisions to address the needs of our residents. It would be important to note that in 2022, we are going to be going through a lead agency review with the state. The revised MinChoices tool will be released. At some point, we need to come into terms of agreement with DHS around our process and timeline for rolling in the legacy personal care assistant assessments, which will now be required to be done by certified MinChoices assessors. And we are continuing to align with other metro counties in terms of their models of service delivery, and working in partnership with community as well as vendor agencies, ensuring they have the onboarding, training, and development that they need to serve our residents. I would leave it to Bridget to see if she has other topics that she wants to chime in on in terms of the next steps.
Nothing from me. Thanks, Maria.
Thanks. With that, I think we stand for questions, and I want to thank you for your time and thank you for my team for the heavy lift to bring all of this very nuanced and complicated information to the forefront. Madam Chair.
Yeah, lots of really complicated information. I'll start with Commissioner Reinhardt.
Oops.
Not hearing you. Oh.
Okay, how about now?
Good.
These double mutes are kind of difficult sometimes. Okay. Well, one thing that all of this has really brought forward, and I know was one of the main reasons we needed to have this discussion now, is because just when we get to the point where we think, okay, we've got this kind of figured out, then the legislature steps in and they make changes. And that, of course, then goes to DHS and that comes to us. And so trying to make sure that we're getting everything done in the right order and by the right people, it has been complicated by some of the things that have happened at the legislature. I think that, and I appreciate all of the nuances of what you laid out for us as far as the problems and some of the shorter term and then longer term issues and solutions, and what you're going to hopefully be bringing back to us. One of the things is when talking about contracted versus in-house, generally speaking, if we need a full-time equivalent to do something, it's going to be oftentimes less expensive because you don't have to build in the profit that has to go in for the worker that's doing the work. But that all has to be, looked at and examined very carefully as far as, again, the efficiency of what is being done and how we can do it. For those things where the state doesn't allow it, they don't allow it. Okay, so we have to try to figure out what case management contracted services look like versus the assessment services, which must be done by a certified, but which must be done by the county. So with all of that said, I think that we all know, generally speaking anyhow, that the legislature isn't putting, they're purposely putting barriers in place. Because it's not as if they're going to go, gee, I wonder how I can make this easier for people to get the services that they need. And again, these are people that are in crisis, that have real needs. And many of these barriers that we're very frustrated by is not of our making. It is the legislature because they don't want to spend the money, but then they turn around and put the bill on us anyway. So it's kind of this vicious circle as far as what we're trying to do. It's very clear to me that our county staff is keeping residents first, absolutely residents first. But each time as they're going through this, they're getting more and more challenges and roadblocks, and it's causing backlogs. And there's a lot of different things. There's a lot of different reasons. There's not, if there was one thing, we could probably try to fix that. But what it comes back to, I really believe, is the legislature. And so we need to, when some of these things come up, and whether it's waivers or changing some of those requirements for check-ins and reassessments, and how that, they have to go through a full reassessment. It sounds like in some cases they do, even though they've been certified 1 year, a year later, they need to go through the whole process again. There's so many different rules. I can't even begin to figure them all out. I'm grateful that you are able to. So I think one of the things that I'm taking from this is, yes, we need to make adjustments, and you're going to get back to us with what they need to be and how best to resolve them as best we can. But I think we also need to work with DHS. Hopefully they can be more of a partner than a regulatory agency. I think most often they're put in the space of regulatory. But when you sit down and talk to people about what we really need, and we've done this in other areas before, they can be an advocate as well. Because if something just doesn't make sense, it costs money and it's not getting services to the people that need it. If we can show that, maybe we have a better chance with DHS and with the legislature. Okay, I'm going to get off my soapbox now because this is it's very complicated, but I think sometimes we look internally to why is this such a problem for us when most of the requirements and things are really external, and maybe we need to spend more time on that. Because we're trying to fix things that we didn't have a part in causing a problem in the first place. And it's impacting our clients.
Thank you, Commissioner Reinhardt. Commissioner Manis-Castillo.
Yeah, thank you. And I guess I just want to say that this workshop, though we shared maybe some hard things that aren't working well, was actually really refreshing. I do think there is a real opportunity here with us being really honest that things aren't working super well. There are things, yes, external influences, but we can still fix our own systems. And I really want to just congratulate you for leaning into this, for the work that you're already doing to address issues of inequity, the disparities between our communities of color and our white communities on accessing these services, but also just in the nuances. This system was built over a long period of time, and we just kept adding more requirements for families, and until a point that it was not achievable for staff, it's not achievable for families, and then we're in this mess. So I hope everyone listening hears that, it's okay for us to get bad news in workshops. It doesn't have to all be painted in a pretty picture, because we can't get to the real solutions without really addressing our own issues. And so I just want to say that I find this, though it was hard, and it's courageous leadership to lean into these areas so that we can address it. So I want to say thank you, and I find it very refreshing because now we know where the areas are and we can get to work. So thank you very much.
Thank you, Commissioner Manis-Castillo. Commissioner McDonough.
Thank you, Madam Chair. Trista, well said. I totally agree with everything she just said there, and really appreciate the efforts that everybody's put into, just laying this out in a way that really is residents first, with a real authentic desire to make the changes to have better outcomes for our folks in a more timely way that really benefits individuals and families. With that said, I just want to make sure as we move forward, and that's why I was really pushing on, the contracted piece versus employee piece, in the next steps, I seen a vague reference to, aligning with other metropolitan counties and the way they do things. I don't know if that's good or bad. You haven't laid things out. Do they get better results with what they're doing? Are their backlogs less? Are they getting less people that hit the 90-day mark and, have to be reassessed? I don't know. So with everything that Tristan just said, and I totally agree with it, and I appreciate everybody's efforts here. Moving forward, I just really want to emphasize how important it is going to be for us to make the decisions based on the data. To really make the decisions based on the data that we have. And sometimes we won't have all the data or enough of the data, but as Trista pointed, Victoria pointed out wisely, legislation's a part of this. I mentioned Ryan and I sat in Abler's office, trying to get, the yearly reassessments done on a MNsure light, right? We got to go in there, like you point out, every time our numbers go up, that means we've got that many more to do every single year. And we tried to convince them that, for most people, their lives are pretty stable and there's a lot changing there. So there is a legislation, but as Trista pointed out, there's a lot under our control, really a lot under control. And using the data that we have, and if we don't have it, to find a ways to get it to make those decisions. So we're not just, shooting from the hip. We're not just looking to, others that are maybe doing it different than us, but not really sure if that's going to benefit our residents in a way that, helps them out in their day-to-day lives. So I appreciate the honesty. I appreciate the report out that you've brought to us. Look forward to the ongoing conversation here, and really encouraged to focus in on the data, putting residents first. Thank you.
Thank you, Commissioner McDonough. Commissioner McGuire?
Thanks, Madam Chair. I have been uncharacteristically quiet, just soaking all of this in, and it is a lot. And just thank you all for everything. I agree with all of my colleagues, with Commissioner McDonough, what he was just saying, and Commissioner Manis-Castillo, right? This is tough work, but it's been great to hear that we're leaning into it. We don't need to talk about this now, but I was, at some point, I'd like to hear we're not the only ones doing this. We may be unique in some of our ways than other people, but I feel like there's these work groups that are going on, and I mean, because I've been familiar with them, I haven't served on them, but I know that there's statewide work groups, because we can talk to our legislators in a group about some of these issues that we have. And so, Jim, are you serving on that, or Amber? I don't know if any of us are serving on those, but I was just curious what the status of some of the statewide work groups and this whole technology Maxis, work that's going on. And if it's too big of a question, I can take it offline too. But I just was curious where that was all at.
I'll go to County Manager O'Connor. He might have a response for that. Otherwise, that might be an offline question.
Madam Chair, I just want to throw in a couple final thoughts and to the team. My comment to that would be, we'll take that as a homework assignment, Commissioner McGuire, and we'll figure out the best inputs. I don't have them off the top of my head, and I didn't see anyone else jump directly in. Did you have more to say? Okay. So in the review running up to today's workshop, what I'll now acknowledge, the only person on here who knew this was Deputy County Manager Hedin. There was going to be a confluence of some of what we talked about a few years back, and that external forces, and also some of the look our leaders are taking internally and where it's starting to come together. And I appreciate those perspectives finding their way to the fore today organically and through the right part of the process, and for staff to get to hear some of this is things that happened externally to us, which doesn't alleviate our need to move forward or own what we can own. And that's a really good takeaway for a committee of the whole type way to kick off the year and get moving. The one spot I was going to ask, as you do the data work and we tighten up, it will help us both internally and externally, is whether we're talking homelessness or criminal justice reform or family stability in general. When we tell our story through the eyes of those experiencing the system, and not only through the systems wide look as we see it as a system, we end up bringing hearts and minds along with us better. And you're already wanting to do a process that does that. I just wanted to say that at the outset, that the more we can explain. We have a few commissioners who have expressed how they have experienced these systems in the past, and they represent thousands who go through these systems and sit on wait lists and get rejected, and the frustration that comes with it. And they represent many across Minnesota, not even just in Ramsey County. I see a unique opportunity for this team to really help lead a story that helps bring those stories forward, because people just don't respond as well when the county says we're shorted money that we need to do the service well, even if that's truly a part of what the answer is. So I just wanted to encourage the team to think about that, and I'm here to help. And we have a board that's clearly expressed an interest in wanting to help on that as well. But my gratitude as well. It was not an all unicorns and rainbows type presentation to kick off in January, but that's okay because our work is not always all unicorns and rainbows.
Thank you, Ryan. And I think your point to stories is well taken. As Commissioner Reinhardt mentioned, a lot of these barriers are put into place by the legislature as we make people jump through more complicated hoops. And usually they're the result of some story or anecdote that may or may not be true about someone with $1 million who got services. And now we need to make sure every person who gets home and community-based services doesn't have more than $3,000 in assets, which is such a small amount. So the point of, as we've talked about with nearly every human services program, that we are putting immense barriers that are not necessary, and that keeps people from accessing services they need. And our job at the policy level and as advocates to continue advocating for less burdensome systems while our staff continue to adjust to taking on that bureaucracy for our people in crisis, our residents in crisis. And this is really a confluence of, you know, the disinvestment that occurred and the buildup as we face pandemic and increase in cases, stressing that already disinvested system on top of this change for who can assess. And from our role as commissioners, asking every single one of our units to be thinking more about how we can generate more revenue and pull every dollar from our other funding sources. I'm really proud of this team for coming forward and kind of laying out the dirty laundry that exists in our backlogs and the challenges and what they're trying to do to fix it. And with that, I'll turn it over to Deputy County Manager Kathy Hedin to close this out.
Thank you, Chair Fretham, and thank you, commissioners. I think I really want to acknowledge the strength of the leadership team here today. I think it is difficult to bring this type of information. I'm absolutely optimistic about the leaders that are in place right now who are going to be looking into how we can do this differently, do it better, and do it together. It's not easy to do. It's not easy to sit here and provide you with information that doesn't sound the best, but I truly appreciate how you asked the questions and how you acknowledged you know, where people are coming from and what they brought today. I think it's important to acknowledge too that our team are community members. They live in this community. They're working through this pandemic. They're exhausted. They have children who didn't go to school yesterday. They're facing whatever is going to come at them in this pandemic. And they're working hard to make sure that our community has what they need, and so that we can serve people the best way possible. So I appreciate the tough questions, and I appreciate the strength of the leadership team today, all of you who are on here who presented and all who helped to create this presentation, and all of you that are going to work to make these changes as we move forward, because it's the right thing to do for our community. So thank you, really appreciate being able to start this out today, this year.
Thank you, and thank you everyone who presented today. We appreciate the information and the opportunity to learn from your subject matter expertise. And with that, I will close this workshop. Have a good afternoon, everyone.
Thank you, everyone.
Thank you. Great work.